Assalamu alaikum. Our lecture today will be about the myelopoiesis, white blood cell types, and their function. As we all know, the leukocytes, or what's also known as the white blood cells, are the mobile units of the body defense mechanism. They are formed partially in the bone marrow. This includes the polymorphonuclear cells and some of the lymphocytes, and also partially in the lymphatic tissue, which includes the thymus and the lymph nodes. This mainly applies for the lymphocytes and the plasma cells. We can classify the white blood cells basically into two types. This depends mainly on the shape of the nucleus of the cell. If the nucleus of the cell was multilobated, consisting of more than one lobe, we call it polymorphonuclear cells. So polymorphonuclear cells, the nucleus consisting of 3 or more lobes. This includes the neutrophils, eosinophils, and the basophils. While when the cells have a mononuclear cell, or what we call one lobe nucleus, this is called a mononuclear cell, which includes the monocytes and the lymphocytes. As we see here in this picture, 3 types of polymorphonuclear cells: the neutrophils, eosinophils, and the basophils, and 2 types of the mononuclear cells: the monocyte and the lymphocyte. Now, as for the polymorphonuclear cells, we basically differentiate between them depending on the staining pattern of the granules in their cytoplasm. If the granules in the cytoplasm take a deep red acidophilic color upon staining, it's eosinophils. If the staining is gray to black, it's the basophils. In between them, it's the neutrophils. The largest white blood cell in the peripheral blood is the monocyte. The polymorphonuclear cells and the monocyte, they mainly act against the invading organism by ingesting them through a process we call it phagocytosis. While the function of the other type of the immune cell, which is the lymphocytes, is rather different. It functions by producing antibodies, by producing cytokines, in conjugation with the other type of cells of the immune system. Now, this table is very essential and very important for you. I think you have to memorize it. This gives you the normal ranges of the total white blood cell count in our body, plus the average percentages and the normal absolute values for each subset of white blood cells present in our body. The total YBC in our body ranges from 4 to 11,000 cell per cubic millimeter. يعني تقريبا خلينا نقول من 4 إلى 11,000. طبعا هذا الرقم ممكن تلقى أرقام مختلفة مثل ما قلنا في كتب، بأنه normal ranges sometimes they can be variable and they sometimes get updated. يعني ممكن تلقى الرقم خلال سنة سنتين ينزل لل 10,000 أو يصعد لل 11.5 variable. The differential count is also, we write it as a percentage, but what's more important than the percentage is the absolute normal value of the subset of the white blood cells. For example, neutrophils, مفروض normally the average constitute about 60% of the white blood cells in the blood, with an absolute number ranges between 2,000 to 7,500. هسه نسأل سؤال: شلون أطلع النورمال absolute value؟ It's very simple method or mechanism. إنه أنا شو أسوي؟ إيش قد راح يطلع لي percentage of the subset of the white blood cells؟ إيش قد راح تطلع لي percentage؟ أضربها في total YBC count. I will get the absolute count of this subset of cell, and then I will compare it with the normal range. Is it below, within, or above this normal range? For the lymphocytes, we have 30% average percentage, and the range between 1,000 to 3,000.5. For the monocytes, 5 to 6%, average range is 0.2 to 0.8. etc. طبعا هذا الجدول مهم جدا لكم طلاب، والمختبر مالت العملي لهذا الأسبوع الثاني راح يكون معتمد تماما على هاي الأرقام الأبسولوت. Even if we don't give you the absolute number of the cells, you should be able to quantify it وتطلعوا لنا إياه أنتو مثل ما علمتكم بطريقة very simple and very easy. مجرد أنه تضرب البرسنتج بالتوتال YBC count you will have the absolute count. ليش ما أقدر أعتمد دائما على average percentage؟ مثل ما قلنا دائما من تكون عندك مسألة ratio or proportion تكون قابلة for deceiving influences، ممكن تكون خادعة. لهذا الأدق إنه اعتمادك يكون على absolute count. Accordingly you say whether this type of cell is increased or decreased, and based on it you will have your clinical decision. When we have increase in the white blood cell count، مثلا أنا عندي patient إجاني والcount مالته 18,000. We call this condition leukocytosis. When you have decrease in the number of the white blood cells, for example, a patient comes with a YBC count of 2,000 or 3,000, we call this condition leukopenia. The same applies for each subset. For the neutrophil, we have neutrophilia, neutropenia. For the lymphocytes, we have lymphopenia, lymphocytosis, monocytopenia, monocytosis, eosinopenia, eosinophilia, and that's it. Now we come to the genesis of the white blood cells. From where the white blood cells are generated. مثل ما قلنا بالمحاضرات الأولى إذا تتذكرون من الأسبوع الأول، generation of all types of red blood cell elements, whether they are red blood cells, whether they are white blood cells, whether they are platelets, they are all generated from the pluripotential hemopoietic stem cells residing inside the bone marrow. وإذا تتذكرون المخطط اللي كنا مطلعيه بالأسبوع الأول قلنا very early in hemopoiesis the pluripotential stem cells will give rise to two lines, the lymphoid generating cells and the myeloid generating cells. We call them the multipotent stem cell that will differentiate into one from two pathways. So we'll have a common lymphoid progenitor cell that will differentiate into lymphocytes, which can be T or B lymphocytes, or can be what we call natural killer cells, which are also a subset of lymphocytes. And we will have a common myeloid progenitor cell, and this common myeloid, when the pluripotential stem cells becomes a myeloid progenitor cell, it will lose the two things that define it as a stem cell اللي هي شنو هي؟ the self renewal capacity اللي هي the most important thing. It will become restricted into one line of differentiation. واللي يقود this restriction into this line of differentiation is what? The appropriate growth factor delivered and the environment of the bone marrow. So it will guide the cells into differentiating to what corresponding cell type that the body demands. This is the same picture we have seen in the first week. This is the pluripotential stem cell. قلنا بالبداية very early it will divide into common lymphoid progenitor cell, and the common lymphoid progenitor cell is going to give me B lymphocyte, T lymphocytes, natural killer cells. طبعا T lymphocyte requires further processing in the thymus, or what we call processing or learning. While the B lymphocytes, they become mature in the lymph nodes. The other subset of the pluripotential stem cell is the common myeloid progenitor cell. The common myeloid progenitor cell, under the influence of appropriate growth factors, they are going to give me erythroid progenitors, common myeloid or white blood cells progenitors, and basophilic progenitors, and according to the growth factors they will give me the end mature cells, which can be red blood cells, can be platelets, monocytes, neutrophils, eosinophils, basophils, depending on the drive, which is the appropriate growth factor and the bone marrow environment. Now, after the stem cell has given me the multipotent progenitor cell of the myeloid component, and then it is committed into the granular site formation, the earliest recognizable precursor of the granular site is known as the myeloblast. إذا تتذكرون بالred blood cells كانت the earliest recognizable precursor we call it the erythroblast. And we said in the erythroblast that it will pass into stages of differentiation until it becomes finally a mature red blood cell. The same thing applies for the white blood cells. The earliest recognizable precursor will be what? The myeloblast. It will also pass into intermediate stages before differentiating into mature cells, mature and polymorphonuclear cells or granulocytes اللي هي neutrophils, eosinophils and basophils. الانtermediate forms من المهم إنه نعرف أسمائها. Why? Because they come to appear in the bone marrow, from the bone marrow in the peripheral blood in many diseases, and knowing their names will help us in diagnosing certain types of white blood cell disorders in the blood. So, the myeloblast will pass into different sequential intermediate forms اللي هي شنية؟ The promyelocyte, then the myelocyte, then metamyelocyte, band stage, finally the mature cells. وراح نشوف شلون تصير أشكالها. This picture will show us the pathway of myeloid maturation. This is the earliest recognizable, the myeloblast. Then differentiating into promyelocyte, then the myelocyte, metamyelocyte, band, neutrophil. Based on the granules type, مثل ما قلنا, we have different intermediate stages. We can, so differentiation between eosinophils and basophils and neutrophils starts where? Starts from the myelocyte stage. We can have a neutrophilic myelocyte, eosinophilic myelocyte, and then neutrophilic metamyelocyte, neutrophilic band stage, and finally neutrophil. The same thing applies for the eosinophilic myelocytes and the basophilic myelocyte, and so on. The same thing applies for the monocytes also. The earliest recognizable precursor will be the monoblast, and then, but they don't have the same pattern of differentiation. ما راح نركز كلش عليه, بس إنه خلينا نعرف إنه المونوبلاست will pass into intermediate forms into promonocyte and then a monocyte. إعادة تذكير the sequence of maturation of the myeloid series in the bone marrow. The earliest recognizable one will be the myeloblast. It will differentiate into promyelocyte and then the myelocyte, metamyelocyte, then the band form, and finally the neutrophils. From the myelocyte, depending on the type of the granules, I will have eosinophilic myelocyte, basophilic or neutrophilic myelocyte. هذا طبعا جوا راح يراوينا شكلها as they appear after staining. Now, the white blood cells are formed in the bone marrow. They are stored in the bone marrow until they are needed in the circulatory system. The normal store of the white blood cells in the bone marrow is about 3 times what's circulating in the blood. And this represents about 6 days supply of these cells. This applies mainly for the polymorphonuclear cells, while the lymphocytes mainly stored in the lymphoid tissue, and they except for a small number that circulate in the peripheral blood. Now we come to the lifespan of the white blood cells. شقد عمرها الوايت blood cells after being released from the marrow. The lifespan of different white blood cells differs according to the type of the cells. So after release from the bone marrow, the granulocyte normally circulates for about 4 to 8 hours in the circulation, and then they leave to the tissues where they are needed. For example, you have an injury anywhere in the body, cut in the skin, trauma anywhere in the body, you have an inflammatory process and you require white blood cells in that spot. The white blood cells are going to leave the circulation, egress from it, and go to the area where it is required. In that area, they will spend another 4 to 5 days before they die, after performing their function. This applies for the granulocyte. Now we come to the monocytes. They also have a short transit time. شو نقصد بالترانزيت time؟ هذا الفترة اللي تقضيها الوايت blood cells in the circulation after being released for the bone marrow، اللي هي بالنسبة للجرانوسايت ايش قد؟ 4 إلى 8 ساعات. بالنسبة للمونوسايت لا، شوية فترة تطول أكثر، 10 إلى 20 ساعة in the blood before they get outside to the tissues. طبعا المونوسايت تختلف عن الجرانولوسايتس. The monocytes, it's called monocytes in the peripheral blood, where they spend 10 to 20 hours. Once they leave the circulation and they enter the tissue, they will enlarge in size, swell, and in the tissue we call them tissue macrophages. So the origin of the macrophage is the blood monocyte, which comes from the bone marrow. As for the lymphocytes, هنا شوي الموضوعية تكون نوعا ما مختلفة. They enter the circulation continuously through the lymph drainage from the lymph nodes and various lymphoid organs. After a few hours, they pass back from the blood to the tissues and they re-enter once again. So it's a state of recirculation between the lymph, the tissues, and the blood. Again and again, the lymphocytes, they have a lifespan of weeks or months, and this lifespan depends on the body need of them. Sometimes some subsets of lymphocytes, especially when we are talking about the memory cells, they have a lifespan of years. Now we come to a question, a very important one, is how the neutrophils and the monocytes defense against an infectious process. We have to put in our mind that it's mainly the neutrophils and the tissue macrophages that attack and destroy the invading bacteria and other injurious agents. Neutrophils can attack and destroy the bacteria even in the circulation, while the tissue macrophages, they have a high capacity for fighting infections. Now, the white blood cells are inside the circulation. The invading bacteria or the pathogen is inside the tissue. How the white blood cells are going to leave the circulation and enter the tissue spaces? The process where the white blood cells enter the tissue spaces is known as diapedesis. Diapedesis. Inside the tissue space, the white blood cells are going to move just like crawling, مثل ما واحد يزحف, by amoeboid movement. And the things that attract them to the site of the inflammation we call chemotactic substances. يعني هي تطلع من الcirculation by a process of diapedesis, and then they will crawl by amoeboid movement through the tissue spaces, attracted to the site of inflammation. How? By chemotactic substances that are released from the pathogens, released from the damaged tissue, attracting white blood cells to the site where they are most needed. Diapedesis شو نقصد بيها؟ It's the ability of the white blood cells to squeeze, or the neutrophils squeeze themselves through the small pores of the blood capillaries. القابلية أن تضغط نفسها وتغير من شكلها بحيث تقدر تفوت من أصغر فتحات البلد capillaries. تقدر تمشي بطريقة الأميب movement، وقلنا يصير بها attraction to the area of inflammation اللي هي نسميها the process chemotaxis، والsubstances that attract them we call them chemotactic substances اللي هي chemical substances تطلع لنا من debris of the inflamed tissue. طبعا حتى البكتيريا or the هاي حنحكي عليها. This is the blood vessel. Okay, the white blood cells inside the blood vessel, leaving through the pores of the capillaries by diapedesis. Then they are moving by amoeboid movement towards what? The focus, chemotactic force, by the release of many chemotactic substances that attract them to the site of the main focus of infection. Now, what are the chemotactic substances اللي تجذب ال white blood cells to the site of injury or inflammation? It can be bacteria toxin, viral toxin. It can be, as we said, the debris or the vegetation products of the inflamed tissue. It can be complement system component products or plasma clotting system components. All these substances are able to attract the white blood cells to the site of inflammation. And as we see here, the concentration of the chemotactic substances will be the highest surrounding the focus of injury or infection. وكل ما نبتعد عنها كل ما تكون concentration مالتها أقل. طبعا it can be effective up to 100 micrometer distance.